Good afternoon. Today I'm going to be explaining the root canal procedure. And so first we're going to greet our patient. We're going to have them come in. We are going to review their health history, make sure they're not allergic to anything, make sure everything's good with their patient. We're going to explain the procedure to them, answer any questions they have, answer any concerns, everything. Once everything is cleared with them, they know what's going on, we're going to have them sign a consent form. Next, we're going to make sure that they have an up-to-date PA x-ray and that shows the whole crown and the root of the tooth, including the apex. And then we're going to make sure that all our basic stuff is set up for our doctor, like our HVE section, our small section, and then of course the air water syringe. And then we're gonna go ahead and use a local anesthetic for the patient. Of course, that includes the needle, the cartridge, and the syringe. And then when that's done, we're gonna go ahead and place the dental dam on the patient, which includes the dam, of course, the clamp, and then the frame. And then, of course, depending on what tooth we're working on, we'll use a universal clamp for the mandibular, the maxillary, or the anterior teeth. And then we're going to go and gain entry to the canal with our Endo Explorer. This also helps us locate the canal, clean and shape them. And then we are going to use our K-type files, hand files, to widen the canal, to smooth it, to remove all the bacteria into the canal. And an RC prep can be used to lubricate it so it's not so dry. And then if necessary, we're going to go in with a barbed brooch. And it's almost like a K-type file. It has like these little fish hooks on the end to remove the necrotic pulp. And of course, the pulp's gonna come out in pieces. It's not gonna come out all at once. And when that's done, we're gonna go in with our endodontic irrigating syringe. Now, this syringe is used to stop the bleeding, disinfect the canal. And in the syringe, we will use hydrogen peroxide or sodium hypochlorite, which is bleach, like I said, to clean, make sure everything's disinfected and such. And then we're going to start shaping the inside of the canal with a Gates Glidden, which is these. And the Gates Glidden with the contra angle is used to widen the canal. And then we're also going to go in with the reamer file. And the reamer file helps us remove dentin, smooth, increase the canal size. And then the spirals on these are further apart just so it helps remove the dentin inside of the canal. And we're gonna go ahead and start sizing our gutta perchas, making sure they are the right size. And when the gutta perchas are inside the canal, we will take an x-ray to make sure they fit properly. And then we're gonna go and dry the canal with paper points. Paper points are very tight cotton rolls, and they're used to dry the canal. They absorb the solution and make sure the canal is dried so moisture is not in. If there's moisture, there can be bacteria, and we don't want bacteria. We want everything to be nice and clean in the canal. And then we are going to start filling the canal, and the instruments we're going to be using is the Master Point Gutta Percha, our temporary restoration, which is like the sealer cement, accessory point Gutta Percha, and then an endo spreader, which looks like this. And then we're gonna go ahead and use a little alcohol torch to heat the glick one to burn off the ends. So this is the glick. We use a torch to heat this. And then we're going to condense the gutta percha inside with a condenser. And it can be any denser, or actually a plugger actually. We can use a regular plugger, nothing too crazy, or we can use the end of the glick instrument. And then we're going to use Cabot with cotton pellet to use as a temporary restoration. And when that's done, we're gonna take another x-ray, make sure everything fits properly. And sometimes the insurance company that's paying for the patient requires one. And then having this x-ray makes everything easier. So when the patient comes in next time, they have a brand new x-ray. And so we're gonna give the patient post-operative instructions not to chew carefully. If there's pain or extreme swelling, to call the office ASAP. Soreness is pretty normal because we just went inside your tooth and did a bunch of stuff. So soreness is pretty normal, but a lot of inflammation is not normal. And then the patient can come back in for their final restoration in about 7 to 10 days after the root canal therapy. And then the next appointment will be when they get that permanent restoration. And then go ahead and dismiss your patient after all the questions are answered and they understand what's going on. Thank you.